Well, hey guys, it's me again. Glad to be back. Let's dive right in. Hope that everybody is doing and feeling good, despite all of our new reality, right? Um, just a quick double check. Your moral theory extreme papers will be due very soon. So if you have any last minute questions or things, make sure you post those in the discussion board or hit me on email. Um, I know it's difficult trying to communicate and stay in touch with everybody. We're all doing our best here. But make sure that paper is in. Of course, the early bird special still applies, so a day early means extra time, redo chance, etc. Um, just take that thesis, make it super extreme, get super ridiculous, uh, and work it through all the moral theories and see how it comes out. So, hope that you actually have some fun with that as well. Uh, Let us then dive in for this week's content, etc. is Chapter 11 in Vaughan, which is delivering healthcare or justice, fairness, and what that means in our current situation as well. So I'm going to switch over and hopefully everything will continue to work just fine. Because the topic or the key idea here in the chapter is what Vaughan and many other philosophers, ethicists call distributive justice. That is, what is fair? And there we have it, the F word. Four letters, starts with the letter F, and no one in my house knows what it means. But fairness, what does it mean? What is it that we are entitled to as citizens of the United States, as people in Ohio in the 21st century? What are you owed? What are your rights just by existing? And what does that all mean? So, distributive justice in the broad sense is how should the benefits of society be distributed? And how should its burdens be paid for? So, in relation to the topic of healthcare, that means who should receive medicine, doctor's visits, surgeries, palliative care, etc., and who should pay for that care? Should health care only be given to those who can pay for it? Or should health care be given to anyone, everyone, and its costs then shared based on an individual's income? I.e., that is, the rich subsidize the health care costs of the poor. That's a fundamental question, isn't it? And that is what we are arguing about currently. That is what a lot of the presidential debates have been about. Uh, that was the major platform for President Obama, and rescinding Obamacare or the Healthcare Act was a major part of Trump's platform. Put another way, is healthcare a right or is healthcare a privilege? That is healthcare like voting, that everyone gets it and we all count equally? Right? My vote doesn't count any more or less than anyone else's vote. Shouldn't healthcare be the same? Should we all be treated equally to at least some bare minimum of care? Or is healthcare more like a car? You get what you can pay for. Only afford a used Civic? Well, there you go. Hey, you got the money for a new Maserati? Go for it, man. It's a privilege. Others frame it in a slightly different way. But before we get there, let's talk about how we got to where we are. And that is that until very recently, healthcare has always been considered to be a privilege, a commodity. Now, partially, this is because there were so very few doctors in the 17, 18, and early 1900s. Now, that changed largely after World War II, uh, and partly because healthcare was seen as a new financial market. More hospitals were being built. It was cheaper for those who wanted to become doctors to get an education and do that. So we had a larger number of doctors and nurses entering the workforce. Major corporations began building hospitals. For-profit healthcare became a thing. And employers began to offer medical insurance as a way to attract workers. Hey, work for us and we'll also cover your health and your family's health care with these restrictions. Medicare was enacted to help to help protect retirees. So just because, oh, I'm, 65 or older and no longer working, does that mean I'm on my own? Well, no, we have a way to make sure that you're still insured, still get your basic healthcare costs covered. This became expanded as Medicaid to help those at low incomes or very special disabilities and other needs. And that's where the fight really begins. Those that see healthcare as a privilege usually fall under the libertarian theories of justice. Those who see it as a right, generally, broadly speaking, fall under the egalitarian theories of justice. I know, we see words like liberal and egal, and it's pretty wild, but libertarians, by and large, are kind of a political, not so much a party, but a ideology that is very, very conservative in terms of rights. That is, they believe in a capitalist free market economic system in which the government is largely hands off, that the government's only role is to enforce contracts, and that at the end of the day, personal liberty is more important than equality. That the only rights that exist are negative rights. That sounds kind of weird, but negative rights are rights of non-interference. That is, your rights end where my nose begins kind of thinking. Negative rights mean that the government or no one else really has the right to enforce me, to coerce me to do something that I don't want to do. Um, an extreme libertarian, for example, is against public highways and roads. Why should my taxes pay for a road that I'm never going to drive on? They might want to see that kind of thing entirely privatized. So every time you go to drive on a road, you'd pay a toll to go on that road for whatever length of time. That sounds rather cumbersome to most of us, and we are willing to accept a certain amount of taxation to make sure there are roads everywhere that we might want to go. Then We push into the realm of egalitarian theories of justice. Those who see healthcare as a right generally tend to favor a more socialist economy or social democracy where, okay, yes, there can be free enterprise and a free market, but that there are much more strict government controls on that market for things like environmental protection, protection against abusive corporate practices, etc. Egalitarian theories favor positive rights, rights that say, no, everyone deserves a baseline of treatment, no matter what. They tend to say, no, equality trumps liberty. Your personal freedoms can be curbed to make sure that everyone in our society has a base standard of living, standard of health, standard of care, etc. That is, that the government can reach into your wallet and distribute that extra you have to those who don't. And so that's why I put those first two quotes here. The "don't tread on me," that's very libertarian theology, or ideology, sorry. And the egalitarian would say something like, from each according to their ability, to each according to their need. That is, the rich should pay to help out the poor. Not just should, but must, and the government's going to make sure you do. So that's kind of the sorry about that, jumped down too far. That's kind of the overview of the two modes of thinking and how that applies to healthcare. The libertarian would say you only get the healthcare that you can afford. It is your responsibility then to save up, set your money aside, and should you need healthcare, you dip into your own savings to take care of it. Whereas the egalitarian would say that's grossly unfair because of the massive differences we have. Those who are poor should not be kept from life-saving medicine or procedure. That in fact doing so actually hurts us all as a society. That if I'm a business owner, I want people to go to work, and part of that means having their heart medication, their insulin, diabetes medication, etc. Where do you fall? Are you more libertarian? Are you more egalitarian? Again, it is not my job to tell you how you should think or feel. These are largely issues that are very fundamental and, in a sense, kind of an ivory tower discussion, but we see its real world implications being played out right now. One way to, some people then try to define it, is that equality is about sameness. That is, everybody gets the same thing. And we see that in this first illustration, each person has a box to stand on. The thing about that is that it only works if we really do start in the same place. But when it comes to personal finances, that's not true. Some people start tall. They start with an amazing privilege because their parents or grandparents were already rich. Many of us fall in the middle and need a boost, and that's enough. But a lot fall in that third category where it doesn't help. Equity is about fairness. It's about the end result. That gives each person what they need. The tall person, the rich, doesn't need much. They don't need a box to stand on. They can still enjoy the benefits of society, watching the game, getting health care, whatever it is. Most of those in the middle need a little boost, and those others might need significant boost. But perhaps you've seen the other one that takes it one step further, and that is removing the barriers. There's still a fence to keep people from charging the field, but it's now a chain link that anybody can see through, that we can all enjoy the game. We can all enjoy healthcare if we remove the systemic barrier. The question for healthcare then is, what is that systemic barrier? Is it merely cost? Is it a financial one? I think there's a lot of evidence that points at that. Is it your starting health in life? I'm a relatively healthy individual. Other members of my family have not been so blessed genetically, have a lot of underlying issues that require extensive medication and care. But then, how do we deal with limited resources? And this is where it really pushes that privilege versus right thing. For example, when it comes to voting, we don't run out of ballots, right? You can just grab another piece of paper, write down candidates. It's not an issue. Yeah, I know we do have times and places where we've restricted voting, and that creates access inabilities, but that's because lawmakers want to disenfranchise certain voters. But it's not a limited resource. Fresh water can be. And in our current example, not enough testing for our current coronavirus pandemic. How do we handle that? If healthcare is a right, but we only have one test for 1,000 people, then who should get the test? The Libertarian says, well, the free market will decide that. The person who can pay the most for it gets the test. The end. Is that the most fair? The most equitable? If you say no, then okay, who gets the test? Of those 1,000 people, who should get it? The CEO at a company or the janitor? The housewife or the police officer? The nurse or the doctor? Or organ transplants? I think we did that earlier in the semester, but of the number of people needing heart transplants far outnumbers the number of hearts that are available. I can't just give you mine. I don't have a spare. You'll have to wait till I don't need it anymore. And then it is a matter of compatibility, and we do have these measures in place. Who is going to benefit from it the most? Who has the greatest life expectancy? Are they a non-smoker? Are they a drug user? All of these things. Or should it be a total random lottery? I don't have an easy answer to all of that. So the question is, dear student, where do you fall? What is the right and fair thing to do? There is a famous moral dilemma that we often use in this situation, and it is called I'm not sure if it has a name, but it goes something like this. Let's say that you are the world's greatest transplant surgeon, and you decide to get away. Go for a hike in the Andes Mountains in South America. When all of a sudden, there is a plane crash there in front of you. You get to the plane crash and you see that there are 5 people. You pull them out of the wreckage and you start doing the triage, and you realize that one person needs a heart, one person needs a liver, the third person needs both kidneys, and the fourth person needs an eye. The fifth person you pull out of the wreckage is the pilot. They are unconscious but healthy. And if you do nothing, they will likely recover and survive, but the other the other 4 plane crash victims, they'll all die. Or, because you're the best surgeon in the world and you can do this, don't worry about reality, you could take all the parts you need from that pilot and give them to the other 4. The heart, the liver, kidneys, the eye, whatever. What should you do? I know, a weird and wild hypothetical, right? But that's the world we're facing right now. Well, let's run it through those moral theories, right? As an ethical egoist, what should I do? Well, what benefits me the most? Well, I'm on vacation, I'm not getting paid, so I'm not doing any surgery. But on the other hand, I am a surgeon and I swore an oath to do no harm. Ooh, what does that mean? To preserve life. So, I'm a surgeon, I'm going to do it. If we're a utilitarian, what do we do? Do we sacrifice the one to save the 4? Yeah, we do. In fact, utilitarianism tells us that we must, if there's a chance that we can succeed, to take the one to save the 4. Not just should we must. What about that's rough, right? Intentionally killing one person to save 4 others? The non-consequentialist theories would probably say something different, right? Let us look first at the categorical imperative. The first piece of that is the universal maxim, which says, only do what you would let anyone else do. Well, would I let someone else carve up 1 to save 4? Yes. If I was one of the 4, would I say yes? Absolutely. What if I was the pilot? You see, this is the key piece to the categorical imperative. You must make it universal for everyone. Make sure you look at these situations from each perspective.
What if I was the pilot, or the pilot's family back home? I would not agree to that. No, thank you. These are my organs. I would like to keep them in my body. I don't care how many people need them. No one else is entitled to my organs except for me. They're mine. Do not tread on me. Do not carve me up without my consent. The means end principle says that we should treat people as people, never, never solely as a means to an end. And so the question is, by carving up the pilot, are we treating them like a person? Or are we treating them like a car, using their parts to save others? Yes. And while it's unfortunate and I could save them and these other 4 are going to die without my intervention, I cannot treat that other person as interchangeable parts. In fact, most libertarian theories of justice look to Kant and the categorical imperative for their moral justification. Rightly so, perhaps. What does Catholicism say? What does the natural law and Aquinas say? Well, purpose, right? What is the purpose? I am fulfilling my purpose as a surgeon, but the pilot's purpose is to live, so is the other 4. Conflict. Yay! Doctrine of double effect. Is the action of taking organs out of one person to save 4 others in and of itself good, bad, or morally neutral? Well, that's the question we're trying to answer. Especially without that person's consent. Remember, they're unconscious. They can't say whether they agree with this plan or not. We'll skip number 2 because number 2 stinks. We'll go to rule number 3. Is my intent good? Of course, I want to save 4 lives. My intent is very good. Does the good outweigh the bad? Yes, 4 is more than 1. Yay! So back to rule number 2 of that doctrine of double effect. Am I using the bad effect to cause the good effect? Or is the bad effect merely a side effect? So let us define it. What is the bad effect? The pilot dies. Who is unconscious, who would recover on their own. I am intentionally killing them by harvesting all of their organs to save the other 4. That's the good effect. 4 people live. Is the bad, their death, the cause of the other 4 living? In this instance, yes. I can't save them without killing him. Especially once I take his heart. Ooh. How about the virtue theories? Maybe they help us out? Well, let's take a look at classic virtue. Classic virtue, what are the list of virtues? I'm a doctor, save life, but do no harm. Ooh, we've got a conflict here, right? What does it mean to be a good doctor? Well, a good doctor saves lives. I'm a good transplant surgeon, so I should transplant organs. Who are my role models? Who are the great surgeons in history and other doctors? Where do we fall on that spectrum of the golden mean? Do nothing, do everything. It looks like I'm pinballing between these two extremes. I don't know. And then we have Carol Gilligan's Ethics of Care and the web and relationship. Well, they all have relationships. They're all important. The pilot and the other four. Yeah, unfortunately, the virtue theories really don't get us out of many of these sticky moral dilemmas. But I would say that by and large, they push us towards the egalitarian view rather than the libertarian view. So let's put it back to those two. And if you need the refresher, let's go back over here to our little chart. And I think I'll post this as well, along with the lecture. That is, looking at just this line, the negative versus positive rights. The libertarian would say, yeah, don't tread on me, don't carve me up without my permission. That even if you are a world-renowned transplant surgeon, you don't have a right to carve up that healthy unconscious pilot, no matter what the result might be. An egalitarian view would say, yeah, he's got an abundance of parts that could be used by others, so they certainly do have a right, an entitlement to those extra pieces. To which one might say, well, yeah, sure, if they were extra, if the guy had a second heart or a third kidney, 2 livers or 14 eyes, sure, you can take a couple extra. But the human body is not built like that. There are limited resources. If we take his heart, he dies. That's the only one. Are people entitled to that? Sometimes these things aren't as cut and dry as we would like them to be. Sometimes there are no easy answers. And that's the other thing I want to leave you guys with. It's part of the reason why conspiracy theories are so popular. It's because we as humans want a simple solution to a complex problem. Somebody invent the pill, the vaccine that cures it and makes it all go away. Poof. The reality is a lot more complex. The best defense we have is washing our hands and staying apart. And we're seeing that in effect. Look at the difference between the infection and death rates from COVID-19 here in Ohio compared to Pennsylvania. Because of what we have done. Because our governor, which probably a lot of us might disagree with a lot of his policies and stances, but in this, he's been a leader. Even though he's a Republican, he has not, kowtowed and begged the president for things. He's understood early on that it is up to the states and local communities to respond. And he has taken drastic measures to protect the lives of his citizens. And it's working. Perfect? Well, no, because there's no perfect solution. This is a virus that operates differently than most others. People are contagious maybe 2 weeks before they show symptoms. It's hard to put out a fire when you cannot see it burning. But we can minimize the impact. Is it fair? Is it fair that I'm locked in my house with 4 teenage females? Is life a matter of deserve? I don't think so. But that's just me. And your agreement or disagreement with my opinion is not necessarily indicative of your grade in this class, right? So, I hope that was helpful. Like I said, I will post this, my lecture notes, if you will, this handy dandy crib sheet, right next to the lecture itself. Please make sure that you are doing the homework and turn in your paper. Remember, there's both. There's the review question assignment as well as your moral theory paper. Your homework is your attendance, so get it all done. And hopefully you'll see my face in video form next week. Thanks. Bye.